Before surgery, I was very active physically, participating in all kinds of different sports, biking, rowing, swimming. Very important part of my life to be physically fit. The knee injury was a kind of a long, reoccurring trauma over many years. Started with wrestling in high school and college, and then you get older, and all of a sudden things start falling apart. I had a significant issue. It was very warped and bowed, and I had completely gone through all of my cartilage and shiny cartilage, and it was just a bad knee. And so when I went and saw the doctor, he did the x-rays and looked at it and said, you got a knee that needs to be replaced. So I spent one night in the hospital. The first day home, Atrinity sent a therapist to my house, and every day for the next 2 or 3 weeks, that started a very rigorous, intensive therapy. We're doing stretches, we're doing exercises, we're doing things that were right to the core. The range of motion and the actual recovery process of the disturbed muscles and so forth. It was all spot on. She'd put the electric stem on there, and it would make my muscles jump around, and then the ultrasound, which got to help, I think, restore the blood flow and get rid of some of the scarring. Part of her job is not just to get the therapy side of it done, but is also to understand who the patient is and what kind of pace they operate on and so forth. I think she followed what my body was telling her to do and what it was able to do, and she kept pushing that as a good therapist does, and she pushed it to the point where I recovered very quickly. Now here I am 6 weeks out, and I have no pain. I have 100% of the range of motion that they're looking for me to get, and basically, I'm just now trying to recover my actual strength that I lost. Most people would look at me and say, there's no way you just had a major procedure done. And I attribute that a lot to the doctor, of course, but also the follow-up care with the physical therapy.